Have you ever noticed that in hospitals, IV bags are almost always hanging high above the patient instead of sitting on a table beside the bed? It seems so ordinary that most of us never question it. After all, if the fluid is going into your body through a tube, why does the bag need to be elevated? Is it simply for convenience, or is there a scientific reason behind this familiar hospital setup? The design of IV bags, the height of the stand, and even the shape of the tubing all work together to keep patients hydrated, deliver medications, and sometimes even save lives. Let's explore why IV bags hang above patients, right here, on History of Simple Things. The idea of delivering fluids directly into a person's bloodstream dates back to the 1600s, although early attempts were crude and often unsuccessful. Reliable intravenous therapy didn't become practical until the late 1800s and early 1900s, when sterile techniques, better needles, and a greater understanding of human circulation transformed medicine. Glass bottles were originally used to hold IV fluids. These bottles had to be suspended above the patient so gravity could pull the liquid downward through the tubing. Even after lightweight plastic IV bags replaced glass bottles in the 1950s and 1960s, the same principle remained because it was simple, dependable, and required no electricity. The main reason IV bags hang above patients is surprisingly straightforward. Gravity creates pressure. When the bag is positioned higher than the patient's vein, gravity pulls the fluid downward through the tubing. This creates what's known as hydrostatic pressure, allowing the liquid to flow naturally into the bloodstream. The greater the height difference between the IV bag and the patient's arm, the greater the pressure pushing the fluid through the tube. Hospitals don't usually hang bags extremely high because only a modest amount of pressure is needed. Raising the bag about 1 meter, or roughly 3 feet, above the insertion site is often enough for standard IV therapy. If the bag were placed at the same height as the patient's vein, the pressure difference would become very small, causing the fluid to slow dramatically or even stop flowing altogether. One reason gravity-fed IV systems have remained popular for so long is their remarkable simplicity. Unlike mechanical pumps, gravity doesn't suddenly speed up, overheat, or lose power during an electrical outage. It provides a steady driving force as long as the bag remains elevated. Nurses carefully control the flow using a roller clamp on the tubing. By slightly narrowing or widening the tube, they can adjust how quickly the fluid enters the patient's body. For many basic treatments, this method is accurate enough while remaining inexpensive and easy to monitor. This simple setup also reduces the amount of equipment needed, making it especially useful in emergency situations, field hospitals, and areas with limited resources. Why not just put the bag beside the bed? Imagine trying to pour water through a straw while holding the glass lower than the other end. The water simply won't climb upward on its own. Blood inside your veins already has its own pressure. To enter the bloodstream, the IV fluid needs slightly higher pressure than the blood at the insertion point. Hanging the bag above the patient provides that extra push. If the bag were placed below the patient's arm, gravity would actually work against the flow. In some cases, blood could even flow backward into the IV tubing if proper safeguards weren't in place. Modern IV systems include check valves and other protective features, but keeping the bag elevated remains the simplest and most effective solution. Not every IV relies on gravity alone. Many hospitals now use electronic infusion pumps for medications that require extremely precise dosing, such as insulin, chemotherapy drugs, or certain antibiotics. These machines gently squeeze the tubing or use specialized mechanisms to deliver fluids at carefully programmed rates. Even when pumps are used, you'll often notice the IV bag still hanging on a pole. The elevated position helps maintain consistent flow into the pump, prevents unnecessary tension on the tubing, and provides a backup source of pressure if adjustments are needed during setup. Gravity and technology often work together rather than replacing one another. The tall metal pole holding the IV bag isn't just a convenient hook. Its adjustable height allows healthcare workers to fine-tune the pressure created by gravity. Many poles also have wheels so patients can safely walk while receiving fluids, helping reduce muscle loss and lowering the risk of certain complications during long hospital stays. Multiple hooks allow several IV bags or medication lines to be connected at once, giving doctors flexibility to deliver different treatments without constantly changing equipment. It's a simple design that has changed very little because it already performs its job exceptionally well. At first glance, hanging an IV bag above a hospital bed seems like a small detail that hardly deserves a second thought. Yet behind this everyday sight is a clever application of basic physics that has helped treat millions of patients for well over a century. By using gravity to create just the right amount of pressure, hospitals can safely deliver fluids, medications, nutrients, and life-saving treatments with reliable consistency. Even in an age of sophisticated medical technology, this straightforward approach remains one of the most trusted methods in healthcare. Sometimes the smartest inventions aren't the most complicated. They're the ones that let nature do the work. And the next time you see an IV bag hanging above a patient's bed, you'll know it's not just there for convenience. It's quietly harnessing gravity to help medicine flow exactly where it's needed. Thank you for watching. If you have suggestions for our next video, feel free to share them in the comments below. We'll be sure to give you an acknowledgement for your contribution.
Thank you for joining us on this journey through the history of simple things. Don't forget to like, subscribe, and stay tuned for more stories woven through the smallest details.